Hi, everyone. This is Karen Yaboa Normat, nurse practitioner from Pros for MPs. Today on Highlighting the Nurse Practitioner, I have special guest Lauren Knobeloch, who is an acute and family nurse practitioner. So today we're just going to talk about her experience as a nurse practitioner working in the emergency room and her experience as a nurse practitioner influencer. Welcome, Lauren. Thank you for joining us today.
Thank you for having me, Karen. I'm very excited.
Thank you. So just tell me about your experience as a nurse practitioner. Did you get your acute care MP first, your family first? Can you elaborate on that?
So I started off with my acute care nurse practitioner. I was in the program for about 1 year when I realized that I wasn't going to be able to see or treat pediatric patients. So then I sat with the dean of the college and talked about it, telling them that I wanted to do emergency medicine. And then we decided to add on the family nurse practitioner courses to my course load for my master's. So I ended up getting both the acute care nurse practitioner and family nurse practitioner by the time I graduated. So it ended up being about 3 years of straight through NP school before I graduated. Had I known ahead of time, I probably would have just gone ahead and gotten my family nurse practitioner for a couple of reasons. All the nurse practitioners I work with in the emergency department right now, they all have their family nurse practitioner. I'm the only one with acute care as well. And then also having your family nurse practitioner, if for some reason I decide I don't want to work in the ER one day, which I don't really foresee happening, but if for some reason I want to go do something else like cardiology or orthopedics, that family nurse practitioner I can use and kind of transition to different specialties. There's also now an emergency medicine nurse practitioner program that some schools offer that wasn't offered when I started going to school for my NP. That is also a dual certification that you can go to school for with family and emergency nurse practitioner. And then you also can sit for your ENP after you've been an NP for so long in the emergency department with some other specific requirements. So my advice would be get your family nurse practitioner if you want to work in the ER, though, to start off with.
That makes sense because we're seeing from like babies to the elderly. But yeah, I saw that they're now having like emergency room nurse practitioner programs, which is awesome.
Yeah, absolutely. Because it's focused on, you get the acute care kind of side of emergency medicine, but you also are getting your family nurse practitioner degree at the same time. So yeah, it's awesome.
It's awesome, definitely. So how long have you been an emergency room nurse practitioner for?
I've been an ER nurse practitioner for 10 years and been in the emergency department for 15 or over 15 total. I started off as a ER tech and then worked as a emergency medicine nurse, total of 4 years by the time I graduated NP school, and then have been in as an NP in the ER now for over 10 years.
A decade. Wow.
Yeah.
Just tell me what's like a typical shift like in working in the emergency room.
So it can vary shift to shift. The volumes of the emergency department are unpredictable. How many patients are coming in, what kind of acuity it's going to be that day. Our shifts vary from 8 or 10 or 12-hour shifts, depending on what time of day you're working and what emergency department you may be working in. You can work in some emergency departments have their advanced practice providers work solely in fast track areas where you're seeing low acuity patients. The one I work in now, we see all acuities. So anywhere from a runny nose to someone having chest pain. It just kind of varies on the day and what you're seeing. And then we also have an area, or one of our shifts that where I work now is a triage shift where you work with the triage nurse to check patients in, get some blood and orders started to get things going so the patient's wait time isn't as long.
And what are the shifts? Like, can you tell me more about like the shifts at the ER you work at?
Yeah, so some of the shifts are 7 to 5 p.m. Some of them are 9 to 7 or 4 p.m. to midnight or overnights or sometimes 8 p.m. to 5 a.m. in the mornings. It varies day to day. Our shift hours are constantly changing depending on what day of the week it is. Like Mondays are usually the very busiest day of the week. And that's kind of I work. It's always Mondays. I haven't been able to figure it out, but it's always Mondays that are really busy. So we usually have more coverage on Mondays, and then Thursdays, Fridays, not as much. So it just kind of depends.
Probably after the weekend.
Yeah.
And then you also said sometimes even though you're done at like 4 p.m., you would have to stay with if you still haven't like finished with the patient, you would have to stay with them until the patient is discharged or admitted to a unit, correct?
Yeah, we typically try our very best to finish the disposition of the patient we're taking care of instead of signing it out to the next provider coming on. In some cases, if it's going to be a couple hours before you have everything back, then obviously we sign out to the oncoming NP, PA, or doctor. But yeah, for the most part, the majority of us don't leave until we're done either discharging our last patient home or getting them admitted. So yeah, that can kind of it can kind of be a little frustrating when you're ready to get out and you're waiting on a lab result or something in order to get a patient home. But
That's good to know. Thinking about working in the ER, that's good to know. What are some of the main diagnoses you see on your shift?
I'd say the most common ones are probably abdominal pain is number one. We see a ton of those. Chest pain, lots of upper respiratory infections. Those probably are the top three things we see. But it can be anything. We see dental pains, GYN complaints, orthopedic complaints, trauma complaints. It really varies day to day. But I would say abdominal pain and chest pains are probably the most chief complaints that we work up regularly.
Gotcha. And do you feel like some patients come to the ER for non-emergency chief complaints?
Yeah, of course. Sometimes I think it's hard for them to know if what they're coming in for is really an emergency. But I like to remind myself sometimes when I'm getting frustrated with the silly stuff that I think people come to the emergency department for, that every complaint is someone's personal emergency. That mom that's worried about that ear pain, it is an emergency to her. And so I treat them, and then I also examine the patient, treat them, and then also at the same time try to educate them about when it's appropriate to come to the ER versus urgent care versus primary care while they're there, because it is definitely something that is hurting the emergency department, making wait times longer when patients are coming for non-emergent kind of complaints. It kind of just backlogs everything.
Education is key, definitely. Definitely. Do you have to work holidays and weekends at all?
Yes. And most of the emergency medicine groups I've worked for, it's typically a total of 4 weekend shifts a month, meaning a Saturday, Sunday would be 4, or 2 full weekends would be 4 weekend shifts a month. And then we do have to work holidays. Most of the time you'll work Christmas one year and then off Thanksgiving, and then the next year you would work Thanksgiving and then off Christmas the next year. Those are the major holidays. And then the group I work for now has 4 minor holidays that they've picked throughout the year, and we're required to work 2 of those minor holidays per year.
Just standard. Which is standard, usually like one as nurses or NPs in the ER, like one winter, one summer. That's standard. Okay.
It's pretty much the same as what the nurses do.
Yeah, gotcha. And did you have to take any additional education courses to work in the ER as a nurse practitioner?
no additional education, but I think it's very important that you have the background in emergency medicine as a nurse, and then also getting as many clinical rotations that you can get in the emergency department, and networking, but very important that you do have some years of nursing experience in the ER before wanting to be an NP in the ER.
Yeah, that makes sense. Yeah, definitely. So how many years would you recommend?
I would say at least 2 years before you start going back to nurse practitioner school. I think that the things that you learn at the bedside and see make so much more sense after a few years when you're going back into your courses, from nursing school to NP school. You just have seen more and done more. And I will also say that some hospital systems are starting to want the nurse practitioners to have their emergency medicine, or their ENP, their emergency nurse practitioner certification too. So that may be something coming down the road for some systems.
Yeah, I get it. Okay. And then what are the pros and cons of working as a nurse practitioner in the emergency room?
Okay, so some of the pros, and I guess the pros and cons could be different for each person depending on what you like and don't like. The pros, I would say, is a flexible kind of schedule. Sometimes you might work 4 days a week, or 4 shifts one week and then one the next week. And sometimes it's kind of scattered all over the place. So that can be a pro or con for somebody. If you are okay with not having a routine, regular schedule, then emergency medicine will be fine for you. I love that you're always learning in the emergency department. We like to say that you have to know a little bit about everything, from like cardiology to GI to orthopedics to GYN. You're going to see everything. So if you don't have one particular area of medicine that you 100% love and only want to do, then emergency medicine is the way to go, because you're going to see everything and treat everything. And I like that. I like to be constantly learning and seeing all different kinds of complaints. I definitely never get bored. There's never hardly ever any like slow time or time to get bored and just sit around. And every shift is completely different. So that part of emergency medicine I love. You also, if you like to do procedures, you're going to have a lot of procedures to do in the emergency department. We do a lot of incision and drainage, suturing, pelvic exams, lumbar punctures. Sometimes with the critical patients, you can do intubations and chest tube placements. So if you like that kind of stuff, then you're going to be doing that in the ER. Cons would be it's extremely fast paced. You kind of got to have some tough skin, as far as like working with other physicians, consulting, admitting patients. You're going to be responsible for doing that primarily on your own. And so you got to know how to present cases and know how to take what they're saying back if they're upset about something too. And then the hours can be crazy, like I said. So if you are a person that needs a Monday through Friday job and getting off at 5 o'clock, then the ER is probably not going to work out in the end for you. And then the burnout is extremely high for emergency medicine, especially since the pandemic. So knowing when you need a break, not overworking yourself, when you need to step back, it's really important to keep an eye on. So but everyone's pros and cons can be different for wherever you're working, and different for somebody else's pro is probably a con for me in the emergency medicine. So
thank you for sharing. Yeah. So experience you get as an emergency room nurse practitioner could take you anywhere. So that's good to know. So what is your advice towards nurse practitioners who do want to work in the emergency room?
So RN experience, like I said, when you're in when you're going through nurse practitioner school, get as many hours in the emergency department during your rotations as possible. Network while you're there with the physicians and other APPs. Get your foot in the door if you can. Getting your first nurse practitioner job in the ER is probably the hardest. And then after that, with experience, you'll be able to go wherever, as far as like different departments and hospitals. And then keeping a log of all your procedures that you do is real important, especially when you're a student. So if you do a laceration, write it down, keep track of how many you've done, if you've done a lumbar puncture during your rotation. That way you can take it with you when you interview. And then I think those were the main points. Oh, if you can get a rotation through a few more specialties, I would recommend orthopedics, gynecology, or surgical rotations. I think are some very important ones that can be helpful when you're actually practicing in the ER too and understanding everything.
Good to know. So make a portfolio.
Yeah.
Keep track of all your procedures. Good to know. And then, earlier you're telling me some of your favorite podcasts or courses. Can you tell us again?
Yeah, so there's a lot of great resources now that are focused on emergency medicine. My favorite podcast is EMRAP, EMRAP, and it's an emergency medicine podcast. They do a 4-hour podcast every month, and you get continuing education hours for it. It is a paid subscription, but they have so many valuable resources. And you also can log in online, and they have like kind of like a library of videos, and you can read like if you want to know more about how to treat, I don't know, a tubal ovarian abscess, you can go on there and it'll go over everything for you, signs, symptoms, diagnosis. So it's a great resource. I also have done the emergency medicine boot camp through CEME. They have a bunch of courses online over the years I've done. Those are great. And that course, the boot camp, is focused for advanced practice providers. So it's excellent. I always have UpToDate. I'm logged into UpToDate when I'm at work too. And that also will get you some continuing education hours too when you're looking up stuff while you're at work. But yeah, there's lots of resources now.
Yeah, I love UpToDate. I'm always just looking up the most up-to-date evidence-based research. So UpToDate's good. I've heard about that boot camp, so I've heard that's really good. So thank you for sharing that.
Definitely.
And my last question is, tell me about your experience as a nurse practitioner influencer and what made you want to become one.
So I started my account np.lauren on Instagram. I think it was about 5 years ago now. And I just started it as a blog in a way to kind of answer questions and show what it's like to be a nurse practitioner in the ER and how I got to where I am and what I do. And it just kind of blossomed into an account now that I share all kinds of stuff on it, from like being a mom to working mom life to emergency medicine to like anything. I love to share anything on that account now. But I also at the same time, I started NPs of Instagram, which now has 15,000 followers, and how me and you connected. And so I have shared about 600 different nurse practitioners on the account. And I started it to kind of highlight and advocate for our careers and all the great things that nurse practitioners are doing, because it is like endless what we can do with our degrees. And I just wanted to promote us in a positive light and kind of help make a better bond and supportive bond between nurse practitioners, PAs, and doctors. I think it's so important, and it's just kind of blossomed into this like huge account where it's tons or thousands of nurse practitioners, and they share their careers, what they're doing, their community service, their small businesses, their podcasts, their continuing education courses that they're creating. preceptors. Students are finding preceptors on there. So I'm pretty proud of it. And it's opened a lot of doors, and just been a great way to meet other nurse practitioners literally across the country. So I love to see and meet and share other nurse practitioners on that account. So if anyone's ever interested, just send me a little DM message and I'll give you all the instructions. It's real easy.
Yeah, so thank you, Lauren, for making, so her Instagram account is MPs of Insta, and thank you for creating it so that as nurse practitioners we could support, network, and learn from one another. So thank you. Thank you again, Lauren, today for just speaking to me today. I learned a lot about your life as a nurse practitioner in the emergency room.
Oh, well, thank you so much. I've had fun talking to you. We'll have to do this again sometime.
Yeah. Definitely. So again, MPs of Insta, MP Lauren, thank you so much.
You're welcome.
Bye.